everyone, and welcome to MedSynapse podcast series, where we bring expert insights into the latest advancements in medicine and healthcare. I'm your host, Hetvi Shah, and today we dive into a topic that affects millions worldwide, which is prostate cancer diagnostics and precision treatment. Did you know that prostate cancer is the second most common cancer in men globally, with over 1.4 million new cases diagnosed each year? While early detection can improve survival rates significantly, many cases go unnoticed until it is too late. But advancements in diagnostics and precision medicine are changing the game. And to help us explore these breakthroughs, we have with us Dr. Vincent Khor, a leading urologist specializing in uro-oncology. Dr. Vincent has been at the forefront of cutting-edge prostate cancer research, playing a key role in establishing MRI-US fusion prostate biopsy services and HIFU focal therapy at University Putra at Malaysia Teaching Hospital. His work is revolutionizing how we detect and treat prostate cancer. So, Dr. Khor, welcome to the podcast. It is such a pleasure to have you here.
Thank you very much, Helvi. Thank you for the kind introductions. I'm still a very young urologist trying to learn as much as possible in prostate cancer. So hopefully today I can answer some of your questions today.
Yeah, doctor. So we're so excited to hear about from your thoughts on prostate cancer, especially. So now, doctor, let's start by discussing some underappreciated or overlooked aspects of prostate cancer diagnostics and treatment. So as a specialist in this field, how do you think healthcare professionals should be paying more attention to?
Okay, so I think there are a few areas that is often underappreciated or overlooked aspects from healthcare professionals in terms of prostate cancer diagnostic and also management. So I think the first most important thing is there are 10 areas, but I'm just going to elaborate one by one. I think first is very important is a psychological and emotional impact to the patients. As you know, prostate cancer, they are very slow growing disease, but the word cancer usually causes a lot of anxiety, depressions and concern, especially in the Asian populations. And because prostate cancer usually affects men, and the treatment usually can cause certain impact, especially toward the sexual functions of the patients. So this the concern about the masculinity and the sexual function is often underestimated in this group of patients. So I think providing access to mental health support and being open to discussions, especially to sexual functions in this group of patients, is also a very important part of our care. Second thing is over-reliance. This individualized risk assessment has to be more emphasized, especially recently with all the advancements that we have. So over the past, we rely more on the serum PSA, which is a prostate-specific antigen testing. It's a tumor marker for prostate cancer, which often leads to overdiagnosis of low-grade cancer and overtreatment of low-grade cancer. So, but now we have more technology, for example, like the MRI prostate. We have a very accurate PET PSMA scans, and we are able to do a targeted biopsy nowadays to actually improve the shortcomings of this. So we reduce the overdiagnosis of prostate cancer, and with the advancements of treatment, for example, like focal therapies, robotic surgeries, we have improved our outcomes in terms of the functional outcomes, and hence reduce the overtreatments of prostate cancer. The third thing is active surveillance. So active surveillance is one of the managements of prostate cancer, especially patients with low-grade prostate cancer. But the problem with active surveillance is the implementation is widely varied, even among institutions in the same country, and different institutions have their own different protocol. So it is very important for us to actually, hopefully in the future, that we can come to a very consistent monitoring protocols, and patient educations about the process is also very important, because a lot of times, especially in the Asian population, they are not very keen to actually go for the active surveillance program. Although long-term study has shown that actually active surveillance versus treatment, the outcome is almost the same. The cancer survival is almost the same. Next is side effects treatment, side effects management. So prostate cancer treatment, whether surgery, radiotherapy, or phototherapy, they have side effects. Especially with surgery, they can have urinary incontinence. They have erectile dysfunctions, fatigue. All these can impact your quality of life. So when we talk about prostate cancer treatment, it's very important that we address all these side effects, and we also must provide enough support to actually manage the side effects with our patients. The other things, like for example, like patient education, shared decision making, genetic testing and genetic counseling are some of the areas that is often underappreciated and overlooked aspects in prostate cancer treatment.
I think that's a great point also. But also one more question is, Doctor, often there's heavy focus on late stage intervention. So could you kindly focus more on early intervention and importance of early intervention also?
So early intervention, we are talking about patient with localized prostate cancer, means that their cancer is just confined into the prostate, and has not spread beyond the prostates into beyond the capsule of the prostate or towards the lymph nodes or distantly. So with early detection, surgery, using robotic surgery nowadays, we can actually achieve a very good outcomes. In terms of the cure rate, can go up to about almost 90 to 100%. And because of the robotic surgery technology, with better visions during the surgery, the outcomes is actually quite good. In terms nowadays, even in places like Singapore, they do daycare surgery where patient actually discharged within 24 hours after a radical prostatectomy. These are the standard treatment. Alternatively, there are some latest advancement or latest technology that is coming up, which is what we call as a focal therapy. Focal therapy is a form of minimally invasive treatment that actually focally ablate or burn the cancer specifically at the location. So when you detect the cancers very early, the cancers might be localized just at one point or maybe 2 points, where we can actually use our technology to actually burn that area. Either we use something that we call as HIFU, it's a high intensity focused ultrasound. We can also use cryoablation, where we actually freeze it. And then we can also use other technology like microwave ablation. And recently there are something what we call as irreversible electroporations that uses a non-thermal approach to actually ablate the cancer.
Yeah, I think there are a lot of advancements in this field, and it is really interesting to learn more about these. So now, Doctor, lifestyle factors like diet, exercise, smoking, and comorbidities such as diabetes and cardiovascular diseases can influence prostate cancer progression. So, in your experience, should these factors play a bigger role in precision treatment plans?
Very interesting. So, lifestyle factors and comorbidities definitely significantly influence the prostate cancer progression. The grade of the cancer is also more higher if you have certain lifestyle factors. Of course, with treatment outcomes. So they actually play a very prominent role in our treatment management. So when we talk about diets, we don't really have a clear, strong evidence to show that which kind of diet is actually causing prostate cancer. But certain studies have shown that diets that is high in the processed meats, saturated fats, dairy products has been associated with higher risk of a higher grade cancer and also higher risk of cancer progression as well. So alternatively, on the other hand, diets which is rich in fruits, vegetables, they all reduce the disease progressions and reduce the inflammations and slow the disease progress. So nutritional intervention can help in terms of improving the overall health of our patients. So these patients, when they go for surgeries, they go for treatments, that translate into a better treatment outcome. So, like for example, even if exercise also, it also can help to mitigate the treatment-related side effects such as fatigue. and muscle loss after operations. So it helps to improve the quality of life. Whereas comorbidities, hypertension is one of the factors that is associated with prostate cancer, and also associated with what they call the outcomes of, they also have an impact in terms of prostate cancer treatment outcomes. So when we talk about comorbidities, we talk about things that are more common nowadays, like for example, diabetes, hypertension, cardiovascular disease. So a good control of diabetes and hypertension, it helps in terms of improving the overall health, and then when it comes to treatment outcomes, it translates to a better outcome. Cardiovascular disease, like for example, heart disease, is actually one of the very important aspects, especially in patients with more advanced or stage 4 prostate cancer, where we have to start them on hormonal treatment, also known as androgen deprivation therapy. All right. So because prostate cancer depends on testosterone to grow, so we give them some hormones to suppress the testosterone. So that can actually makes their cardiovascular risk or disease even more serious. So addressing that and try to optimize the cardiovascular disease is actually very important.
Yeah, I think it sounds like a holistic approach also, like which integrates like some lifestyle modification and also precision medicines. So now talking about precision medicine only, doctor, it is revolutionizing cancer treatment, but it also raises some ethical concerns, especially due to cost and accessibility. So how do you navigate the dilemma of offering advanced diagnostics and treatments to some patients, but not the others who cannot afford or something?
Okay, so maybe we can put it that way. Like as you pointed out, precision medicine is transformative, but it's also come with significant costs and can be inaccessible to certain populations. So this brings about the ethical dilemmas, especially when considering how to balance the access and also the treatment cost. So I think the key ethical issue here is justice and autonomy. So I think the first one, justice, ensuring that all patients, regardless their socio-economical status, have equal access to the best possible care. With this precision medicine, there's a risk of what we call is that exacerbating the healthcare disparities. Whether the more wealthier patients can afford a more advanced diagnostics and treatment, and those who cannot, that could lead to injustice or too tired healthcare system where some people receive the best and some people receive a more outdated treatment or more generic treatment. The other key ethical issue here is autonomy. Patients need to have the right to the access to the treatments that could potentially improve their outcome. So when this access is constrained by financial or geographical factors, this actually creates a situation where there are some patients who there are only a certain patient who can actually exercise this autonomy fully. So how we can navigate this is we can actually few things, at different level, at maybe at the policy level, we can actually increase the healthcare system support. The government, the insurance providers, or the healthcare institution can take a more active role in ensuring the equitable access to all this advanced treatment. As a clinicians, I think we should prioritize a cost effectiveness in our treatment. And we should also practice shared decision making with our patients. So as a healthcare professional, I think our role is more on advocating equitable access. And at the individual levels, I think we can also work to ensure that patients are informed about the emerging technologies and potential treatments, while also considering the alternative when advanced options are not available. In countries like Malaysia, you cannot compare with Singapore. So when all these advanced options are not available, what are the best alternatives that we can provide to our patients? So in this way, the clinician can help in minimize the ethical tension between offering precision medicine to some and not others, by ensuring that no patients are excluded from necessary or effective care.
Correct. I think at each level, everybody should do little by little whatever is in their hands, and I think that can also change over the years.
Yeah.
So now, Dr. Liquid biopsies are also becoming more prominent in cancer diagnostics. So how do you see this technology evolving for prostate cancer, and could it eventually replace traditional biopsies?
Okay, it's very good questions. So liquid biopsies, a lot of people don't understand what is liquid biopsy. It's a very exciting advancement in cancer diagnostic. It's something that's very new, and in the case of prostate cancer, it actually has a significant potential for both detections and monitoring of our prostate cancer. So, what is liquid biopsy? Liquid biopsy is actually a way or method or technology for us to analyze the blood, urine, or any bodily fluids that we can use to detect circulating tumor DNA, genetic mutations, monitor tumor dynamics, and also probably assess some minimal residual disease. So in prostate cancer, some study has shown that it can help to identify genetic alterations, and also we can also identify some markers that can be associated with aggressive disease or treatment resistance. So the future is very promising, but at the current stage, the evidence for routine use is still not very strong yet. So they show great promise, but they are very unlikely to replace traditional biopsies in the near future, in the immediate future. So traditional biopsy is still very essential for providing histopathological information, assessing the tumor grade and morphology, and the liquid biopsy can complement traditional biopsy, but they are not likely to actually replace biopsy yet in the near future.
I think that's exciting also, and I think liquid biopsies are less invasive also, so that also could transform how we approach prostate cancer.
Yes, but it's at the moment it's still very costly, and there's no standard for us to define the cutoff, and to actually introduce it to the routine use yet. So I'm quite sure in the future these things will improve, and we probably can see that we eventually will reduce the reliance to a traditional biopsy.
Yes, let's hope for the best. So now, Doctor, another key factor in treatment is patient-reported outcomes such as quality of life and even symptom burden. So how do you incorporate these into your treatment decisions, and why are they critical in prostate cancer?
So good questions. So this incorporating patient-reported outcomes are very, very important in prostate cancer, particularly because prostate cancer treatment actually results in certain disturbance or impact to their quality of life. So in practice, we usually will incorporate patient-reported outcomes using a validated questionnaires, like for example, our EPIC questionnaire for prostate cancer, related to quality of life questions during our follow-up visits, and then also to capture the patient's self-reported symptoms. So this will actually integrates into our clinical decision-making process, and in terms of the treatments and management, and these are often discussed in our multidisciplinary team meetings. So they are used to guide not only clinical intervention, but also help us to provide the necessary psychological supports to our patients.
I think that is also really important, like the psychological support is really needed also in these patients, I think.
Definitely very important, because treatments of prostate cancers often results in significant impact to the quality of life of our patients.
Yeah, I think that is really important. Rightly mentioned that it actually impacts your quality of life also. So now, Doctor, lastly, patient cancer outcomes vary significantly across different regions and populations. So in your view, what are the root causes of these disparities, and how can healthcare systems address them?
I think you're quite right that these disparities actually happens in different regions and populations, and actually these factors actually contribute to difference in terms of early detections treatment and also the survival rates. As you can see in most of the developed countries, they have more patients who are detected earlier, hence better treatment outcomes and better survival rates. Whereas in places like Malaysia and the Asian countries, usually we have patients who are detected more later stage, hence the outcomes or the quality of life might not be so great as compared to people who have an earlier stage. So it's very important to first identify the root cause. What is the root cause of the disparity? So socio-economical or geographical factors where we would have to look into their access to the healthcare, the insurance or the financial barriers. Prostate cancer treatment can be very, very costly. And in certain places, there's this racial or ethnic disparities where, certain races or certain ethnics, they have lesser access to healthcare. And very importantly, I think, is the healthcare awareness or the patient's awareness. So we need to do more in terms of educating our patients in terms of the early detections of prostate cancer, the treatments and the address all the barriers that leads to early detections. And so how can we address all these disparities? We can actually do things like we improve the access to screening and early detections through screening programs by the country or by the institutions, do more public health campaigns, whether regional or nationwide, to educate the population about prostate cancer risk factors, early detections, and available treatment options, so that the man can seek timely care. And at the more policy or governmental levels, we can help through policy or financial support, we can help to reduce the healthcare inequality in terms of prostate cancer care.
I think addressing these disparities is also ensuring and also spreading the right kind of awareness among the public is also necessary, I feel. So, Doctor, as we wrap up today's session, thank you so much for joining us, and this has been an incredibly insightful session. So, thank you so much, Doctor.
Thank you very much.
Yeah, and to our listeners, thank you for tuning into this episode. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay aware and stay healthy.